There is something millions of people over 60 do every single night. Something that feels completely harmless. Something that feels like a reward after a long day. Something that has become so routine, it does not even register as a decision anymore. It happens in the hour before bed, sometimes 2 hours before. And what it does to the heart of a person over 60 is something cardiologists have been documenting for decades. Not dramatically, not in a way you feel until it is too late to reverse easily, night after night, in a body that is already working harder than it was 20 years ago, just to maintain the same output. The heart after 60 is not the heart of 40 or 30. What it can tolerate at night has changed. What it needs from the hours before sleep has changed. And most people over 60 have never been told what those changes actually mean for the decisions they make before they close their eyes. Picture this. You were getting ready for sleep. Perhaps an hour had passed since your night routine began. You were winding down. The television was off. Or you were reading. Or sitting quietly. And then, almost without thinking, you did what you usually do at that hour. You drank a large glass of water. Perhaps a tall glass of ice water. Perhaps a full bottle beside your nightstand. Something familiar. Something that signals to your body that you are staying healthy. Something that has been part of your evening for years. You did not think of it as a cardiac decision. It felt like a healthy thing to do. It felt like responsibility. It felt like the one simple good habit the evening reliably offered. But inside your chest, something very different was happening. Your heart was receiving a signal it was not designed to receive in those particular hours. A signal that changes what your heart does for the rest of the night. A signal that in a body over 60 carries consequences that the same signal simply did not carry at 40. And most people never connect the water glass on their nightstand to the heart working quietly in their chest. To understand what excessive late-night water intake does to the heart after 60, you first need to understand what the heart is doing during sleep, because the heart after 60 is not simply resting at night, it is recovering. The distinction matters enormously. During waking hours, the heart of a person over 60 is managing a cardiovascular system that has changed significantly from its younger state. Arterial walls have stiffened. The aorta, the largest artery in the body, has lost some of its elasticity. The left ventricle has thickened slightly in response to decades of pumping against increasing arterial resistance. The heart is working harder per beat than it was 20 years ago. For the same output, it is generating more pressure, using more energy, experiencing more wear per cycle. Sleep is when the pressure drops. Cortisol, the primary stress hormone, falls to its lowest point of the entire day during deep sleep. Heart rate drops, blood pressure drops, the cardiovascular system enters its most restful state. The left ventricle finally works against reduced resistance. The arterial walls experience reduced pressure. The entire system decompresses. This nightly decompression is not optional. For the heart over 60, it is essential maintenance. Now introduce a surge of extra fluid volume into this system 1 to 2 hours before sleep. In 2000, Dr. Jens Peter Nørgaard and colleagues published research on nocturnal polyuria and cardiovascular fluid management in adults over 60. Their team found that drinking excessive water before bed creates a rapid expansion of intravascular blood volume right as the body lies flat. Lying flat redistributes fluid from the legs back into the chest and central bloodstream. Combine that with a fresh glass of water, and central venous pressure rises dramatically. The heart's upper chambers, the atria, are stretched by the extra fluid volume. Instead of resting, the heart is forced to release a hormone called atrial natriuretic peptide to signal the kidneys to flush the excess liquid out. This forces the heart to act as a pressure pump during the exact hours it was supposed to be recovering. The effect had a name among cardiologists and urologists studying nighttime physiology. They called it volume-induced nocturia and autonomic disruption. Physicians noticed that forced nighttime fluid excretion triggers repeated awakenings during the night. The pattern was consistent: a large glass of water before bed, fluid overload during horizontal sleep, repeated sudden awakenings to urinate throughout the night, volume overload. The connection was not coincidental, Biscardi. It was physiological. And in a body over 60, the threshold at which fluid intake triggers this cardiovascular strain is considerably lower than most people assume. In the late 20th century, cardiovascular researchers studying nocturnal physiology began noticing a strange pattern in older patients. Physicians were sharp, observant, the kind of clinicians who noticed patterns before anyone told them to look for them. And over the years, they had noticed something. Patients who complained of waking up 2, 3, or 4 times a night to urinate were showing signs of severe cardiovascular fatigue. They had elevated blood pressure spikes at night, irregular rhythms during sleep, daytime fatigue, breathlessness, and morning hypertension that had woken them from sleep. They had no obvious explanation, except one. They were all drinking large amounts of water in the final hour before closing their eyes, not because they were thirsty, because they believed it was preventing dehydration or heart attacks. A large glass on the nightstand, chugging 2 full cups before turning off the lights. The kind of health habit that millions of people consider completely normal. Researchers began documenting these cases. They pulled nighttime blood pressure and cardiac output monitors. They cross-referenced nightstand water consumption with nocturnal cardiac strain. The pattern was unmistakable. Every sudden awakening caused by a full bladder was preceded by a sharp surge in sympathetic nervous system activity and blood pressure spikes. Studies officially documented the phenomenon in cardiology journals. They proved that forcing the cardiovascular system to handle expanded blood volume while lying flat doubled the mechanical workload of the heart. The medical community initially treated bedtime hydration as harmless advice, a habit specific to healthy living, an observation relevant only to kidney health. But cardiovascular researchers insisted the threshold was lower than people assumed. They were right. Subsequent research confirmed that in adults over 60, even 16 ounces of water in the hour before sleep produced measurable spikes in central venous pressure and disrupted sleep cycles. Changes consistent with nocturnal hypertension, changes that grew more pronounced as the decade progressed. Cardiologists had seen it on cardiac telemetry for years before the public understood the connection. They published what they saw. They named what they saw. And decades later, bedtime fluid overload sits in the cardiological literature as a major hidden trigger for sleep fragmentation and nocturnal cardiovascular stress. They were not warning against staying hydrated during the day. They were warning about the big glass of water on the nightstand before bed, for a heart that had reached the age where that distinction no longer existed. Now I want to go deeper into what sudden fluid expansion actually does inside the heart during sleep. Because the fluid overload connection is only the first mechanism. There are 2 more, and both of them are specific to the cardiovascular system after 60. The first involves the autonomic nervous system. Your heart rate and blood pressure are regulated by 2 competing branches of your autonomic nervous system. The sympathetic branch accelerates the heart and tightens blood vessels. The parasympathetic branch slows it down and promotes rest. During sleep, the parasympathetic branch should dominate. Heart rate drops, rhythm stabilizes. The heart enters its recovery cycle. Drinking too much water right before bed severely interrupts this balance. When you lie flat with a full bladder and expanded blood volume, your stretch receptors send emergency signals to the brain. When the bladder fills to capacity in the middle of the night, it triggers a massive sympathetic nerve spike called the vesicovascular reflex. Your body jolts you awake. Heart rate shoots up. Blood pressure spikes instantly. This sudden spike typically occurs 2 to 3 hours after falling asleep, which places it precisely in the middle of the night. Precisely in the window when the heart is supposed to be at its lowest workload. In a body over 60, where arterial walls are already stiffer, a sudden nocturnal spike in blood pressure carries far more risk than the same surge at 40. The vessels have less elasticity to absorb the sudden hydraulic pressure. The left ventricle works against higher resistance during the precise hours it was supposed to be resting. A 2019 study on nocturnal blood pressure disruption in older adults showed that forced awakenings from fluid overload caused sudden arterial pressure spikes averaging 10 to 15 millimeters of mercury above baseline. In clinical terms, that elevation is significant. Over months and years of nightly fluid overload and abrupt awakenings, it contributes meaningfully to arterial stiffening and left ventricular hypertrophy. Left ventricular hypertrophy is the thickening of the heart's main pumping chamber wall. It is directly associated with increased risk of heart failure and stroke in adults over 60. The second mechanism involves sleep architecture. Waking up to urinate destroys deep sleep cycles. The glymphatic system, which clears waste from the brain, operates primarily during deep sleep. The growth hormone pulse, which triggers bone and tissue repair, peaks during deep sleep. The cortisol nadir, which allows cardiovascular decompression, occurs during deep sleep. Bedtime water overload fragments sleep, preventing the brain and heart from sustaining deep sleep. You think you are hydrating your body, but the core repair does not happen. And for a cardiovascular system over 60, that nightly repair is not a luxury. It is the maintenance that keeps the system functioning. Skip it consistently, and the deficit accumulates, year after year, glass after glass, in a body that no longer has the same capacity to absorb the deficit and recover. Here is what I want you to understand about your heart, specifically. After 60 months, your cardiovascular system has changed in ways that are real and measurable and important. Your arterial walls are less elastic than they were. Your left ventricle is working harder per beat than it was 20 years ago. Your autonomic nervous system takes longer to complete its overnight recovery cycle. Your heart needs the hours between midnight and 4 a.m. more than it ever did before. And every night you drink a large glass of water before bed. You are setting up a physiological sequence that works directly against that need. First, your blood volume expands just as you lie down flat. Then your heart is forced to pump harder to manage the fluid surge. Your bladder fills rapidly and triggers a sympathetic stress response in the middle of the night. Your blood pressure surges when you are jolted awake to go to the bathroom. Your left ventricle works against higher resistance during precisely the window it was supposed to decompress. Your electrical conduction system experiences sudden stress surges. Your deep sleep is fragmented before the glymphatic cleaning is complete. Your growth hormone pulse is blunted before the repair window closes. Your cortisol nadir is disrupted before the cardiovascular system has fully recovered. All of this happens while you think you are doing something healthy. You are in bed. You feel good about drinking your water as you drift off. You feel refreshed. You feel the reward of a healthy bedtime habit. And your heart pays for it silently, between 2 a.m. and 4 a.m. while you sleep. This is not a lecture about dehydration. That is not what the science is saying. The science is saying something far more specific. Timing matters. The difference between drinking plenty of water at 4 p.m. and chugging a large glass at 9 p.m. is not trivial for a heart over 60. At 4 p.m. your body has hours to process the fluid while you are upright and active. Your kidneys filter it efficiently. Your heart handles the fluid dynamics in a waking state. By the time you sleep, your fluid balance is neutral. The cardiovascular system enters sleep in a clean state. The repair window opens without interference. At 9 p.m., the situation is different. The fluid expands your bloodstream right as you lie flat in bed. The sympathetic blood pressure spikes arrive at midnight. They arrive precisely when the heart needs quiet. If you are worried about staying hydrated, shift your water intake to the daytime and early evening hours. The threshold for fluid-induced nocturnal cardiac strain in adults over 60 is lower than most people assume. 8 to 12 ounces of water right before sleep is enough to trigger measurable fluid shifts and sleep disruption in susceptible individuals. A tiny sip to swallow night medications causes no disruption. Finishing your main hydration 2 hours before bed causes none. The choice belongs to you, but it belongs to an informed you, one who now knows what is happening inside their chest in the small hours of the morning while they sleep. Cardiologists stood in hospitals and sleep clinics for decades watching patients arrive with fragmented sleep and nocturnal hypertension. They asked a simple question: what did you do right before closing your eyes? The answer was always the same. They published what they found. They named what they found. They spent years trying to tell people that the threshold was lower than they thought, that the nightstand water glass was more cardiac than it appeared, that the heart over a certain age had changed the terms of what fluid volume it could absorb in the evening hours. Most people did not want to hear it. The bedtime glass of water was too familiar, too comforting, too established as a healthy habit. But the heart was hearing it, every single night, in the silence between 2 a.m. and 4 a.m. when nobody was watching and nothing was felt. Your heart has been having that conversation without you for years. Now you know what it has been saying. What you do with that knowledge tonight is entirely up to you. The heart will respond either way, like always.